Okay, hopefully, let me know if I start lagging, but hopefully this should be good. Okay, thank you everyone. We're here with Student National Medical Association featuring Mind the Gap, inspired by Malone Mcquinde, featuring not only Malone Mukwende, but Dermatologist Dr. Tiffany Mayo. And Dr. Tiffany Mayo, if you could reintroduce yourself briefly.
Sure. I'm Dr. Tiffany Mayo. I'm an assistant professor of dermatology here at the University of Alabama at Birmingham. I have a special interest in skin of color and conditions that are very prominent in this population, including hidradenitis suppurativa, scalp and hair disorders, dyspigmentation disorders, and things such as that. I'm very happy to be here speaking with you all today, and I'm excited you put this on.
Okay. And Malone, if you could briefly introduce yourself.
So hello, my name is Malone Mcquindy. I am entering my third year of medicine studying at St. George's University of London. I'm also one of the co-authors of Mind the Gap, which is a clinical handbook of signs and symptoms in Black and brown skin, and recently the founder of Black and Brown Skin, the website. And of course, I'm excited to be here speaking to you guys. It's a completely different environment to the UK environment, but it's great.
And we're going to definitely get into Mind the Gap and Black and Brown Skin Company in a second. Dr. Mayo, Allison has prepared some questions to explore your background.
Sure.
Yeah, so just getting into our first question. So what catalyzed your interest, Dr. Mayo, in dermatology, specifically studying ethnic skin and nails?
So my interest, can you hear me? There's a little bit of an echo, but it doesn't bother me unless it's distracting and everyone else hears it. Does it sound okay? Okay, perfect. My interest in dermatology really started with a desire to help a family member. My aunt had suffered from a type of hair loss, a scarring alopecia, for several years. And so as a teenager, you know, I really felt this, this drive to want to learn more about this because of the effect that it had on her life. Well, anyway, I kind of forgot about that a little bit in my pursuit of medicine. You know, medical school can be quite challenging. And so as a fourth year medical student, I actually was planning to apply for internal medicine. And so I did a rotation in dermatology, as most of you will do a short rotation at least. I hope it'll be longer though, in dermatology, to learn a little bit about the skin. And the dermatologist I chose to rotate with had an interest in skin of color. So during this rotation, I saw this textbook, and it was Dermatology for Skin of Color. And I thought, I'm going to take a look at this, and because there are some things I've been wondering about. And so I remember flipping through this book and just kind of being shocked at all the things that I was seeing that hadn't necessarily been expanded upon in my medical education, but I was very interested in them because it related directly to, you know, things maybe I had experienced with family members or questions I had been asked by patients that were very specific to skin of color. So one day this attending physician saw me flipping through this book, and I was actually reading about CCCA, which happens to be the type of alopecia that my aunt had. And he said, you know, that's really common in Black women. And I said, I know my aunt has this. I can't wait to tell her, you know, more about it now that I'm reading about it. And he said, it's so common. Can you believe no one is studying this? And so I remember like pausing, and I looked at him, and he goes, you should do something about that, you know, and just kind of walked away, just very casual. But I'll never forget that, because I guess before then I was just so caught up in medical school, and I kind of thought that there was like somebody with a list of all the medical conditions that needed to be researched, and they were divvying up the research. You know, I don't know what I thought, but I didn't realize until then what really drives research and interest in things is someone's passion in something. And so sometimes to have a true deep passion in it, you have to be able to relate to it. And it just kind of clicked that this is what I need to do. There is obviously a big need, and this is somewhere that I can really make a difference, not only for patients, not only for my community, but also teaching and getting other people interested in dermatology, focusing on skin of color.
Great. So I know you mentioned that really you only saw a textbook. So can you speak more to the deficit of, education on treating ethnic skin and nails? Like what else have you observed?
So one is not really highlighted, right? There may be sometimes you learn about disparities in healthcare, but then you don't really learn much about how are we addressing those disparities? Like what extra efforts, are we doing? You often only kind of brush the surface when you're learning about these things in medical school, and then you go off to your respective specialties, right? So one, I would say that's kind of the big piece is just learning about it right up front when you're learning about medicine, and then you can apply it as you continue your career, regardless of what you go into, because dermatology spans every field, right? There's systemic or cutaneous manifestations of systemic disease, and you're going to see these systemic diseases in all skin types. And so that cutaneous manifestation may just be the clue to help you figure out what's going on when you otherwise, may kind of be stuck. So I feel like the biggest deficit is just in the medical curriculum. Also, which, we really, are fortunate that Malone has gotten media's attention for this, because this is not new. This is not a new issue. There are pioneers in dermatology who have really devoted their entire careers, lives, to bring more attention to conditions affecting skin of color patients, and support for research for those conditions. There's even, societies that have been working toward this, but, you can work and work and work and not really get attention until, something happens. And now here we are, and Malone, you kind of came right at a great time to get people's attention, because people have been working trying to get this attention for a very, very long time, and publishing and doing a lot of research. So I feel like that's one thing. So then the other part of that is diversity in the field. So like I said, in order to have people who understand the needs in different cultures, the needs in different communities, it's beneficial to have someone from that community or from that culture, right? So in medicine, there's been a lack of diversity in dermatology for a very long time. And so some of the things that affect skin of color, it's not that they've been ignored, it's just there was no attention to them because maybe people didn't understand that there needed to be attention. So I would say, medical school curriculum is often lacking. Diversity in fields that actually brings knowledge and adds, to fields has been a little bit lacking. And then attention to things that people have been, underrepresented minorities have been trying and to gain support and funds for furthering research in areas, and that just hasn't really caught much traction until recently.
Yes, and I think you kind of brought up a good point that transitions into our next question, that how has you being a Black woman influenced the way you provide care to Black women and other women of color? I recently saw an article that talked about how there was a group of dermatologists that couldn't identify what was going on with something at the base of someone's forehead, and it was actually like tinted edge control. But if you don't know what that is, that's not something that you're able to identify. So can you speak more to that?
Yeah, the residents get a kick out of me knowing what products patients are using based on their smell. But, so as a Black woman, I can relate to a lot of things because I've used, Blue Magic hair grease too. I've used, all these things. Then I also know the things that have bothered, Black women about their hair or about their skin, or, or things that they may be embarrassed to show other people. I have several patients, and I give lectures to the residents actually on this, who will tell me no one has ever seen my scalp except for you. Like literally they are crying as they're taking their wig off because it's been something that they have been so embarrassed and so ashamed of for years that, and they feel comfortable with me because they feel like I can relate and I can understand and I can actually empathize with them. So, that's one of the other reasons that I feel I have been so fulfilled as, career-wise in this field, because women, especially Black women, have kind of been told your hair isn't good enough. It's your skin isn't, beautiful enough, or, all these things, or you need to look this way if you want to be considered beautiful, and your hair needs to look this way. And there's no hope. No one cares about that, which in the research world, very few people are showing that they're, given true interest, because the natural hair stuff is new, right? Products for natural hair, all these things are new. So I feel like I have an opportunity to give hope and help to people who have felt hopeless and helpless regarding their conditions for a long time, and then also educate residents who will then go out into the field and educate medical students on not only to address the dermatologic condition at hand, but then also understand what patients are coming to the table with, all the baggage that they're bringing to the table, and not put the burden of disease on patients by saying, oh, it was your hairstyle. You shouldn't have worn your hair like that, or you got all those relaxers and now you're losing your hair. All the burden of disease shouldn't be just kind of thrown on the patient and they're given a cream or something. You really have to understand where patients are coming from. And I feel like that's one of the opportunities I have as a Black woman and as a dermatologist.
It's beautiful. So lastly, for those who are currently interested in dermatology, since we realize how important it is to get exposure to so many different skin types, how crucial is it to look for a residency program that can have a diverse patient demographic, or just truly supply the education that's needed to serve a diverse patient population?
That's a good question, because dermatology is a very competitive field, which, we can get into how in the world did I go from Utah, Alabama to being a dermatologist. That's not a straight and narrow type of pathway there. So it's not like you have a lot of options and say in the matter when you're interested in dermatology. It's kind of like, man, if I can get in, I'll go anywhere. But then there are other resources. So there's the societies like the Skin of Color Society. There's actually 2 Skin of Color meetings that are held every year, especially, those would be great resources for people who found themselves in a location where they're not really seeing a lot of ethnic skin, which that exists. I mean, there are residents who get very minimal exposure to, and medical students who get very minimal exposure to skin of color. So there are those resources. And then there's also the external rotations. Well, before COVID, I often would have a high school student or a medical student kind of shadowing with me just to see what I do. To see me also, right? To see a Black woman in medicine, but then to also understand that dermatology is not just acne and it's not just cosmetics. It's not just the things that you see. Dermatology is an entire organ that kind of spans the entire spectrum of medicine. So I really think that rotations, reaching out to like the American Academy of Dermatology, looking specifically at their diversity initiatives and getting involved there are other opportunities, rather than just specifically trying to find a program in a diverse area. Even though that's the best, if you can get that, that's awesome.
That's great. And like you were saying earlier about the diversity, and finding that diversity is so huge, and seeing that in clinic on your rotations back before COVID is crucial. And something relating to just my experience in medical school, I was speaking to a young woman who, the ICM group, the Introduction to Clinical Medicine group, they were seeing a patient, and she was telling me about how she was the only person of color in her group, and they had to take a pulse on the patient's foot, and the patient was African-American male, older Black male, and his skin was ashy. He had flake skin. It was more white, And a lot of the other students had not seen that. And they thought it was a pathology and were concerned about touching it. And that exposure to it, something to a lot of colored people and Black people, is very simple, just with lotion, ashiness. But to people who've never been exposed to that, it could be confused for something else. And in medical education, that is huge. And after some of our earlier discussions, we were looking into what would be the best way to move forward as far as thinking of a name for these. And I thought of a name, Mind the Gap. And subconsciously I thought, oh, I just thought of that on my own. But I remember I saw Malone's story, and I was texting with Allison about that. And I sent the name of Malone and the cover to the book. And I'll share my screen briefly. And with that, Allison responded, we're gonna get sued if we do that. So I thought to DM Malone on Twitter, and conversation went to email, and eventually just asking, hey, would you like to come speak? And seeing his story and what it represents to, like what Dr. Mayo was saying earlier, people who spent their whole lives researching and advocating for the inclusion of Black skin. What was so special about his story, and it connected at a right time with everything going on in the world, where the interest has grown so much. And so without further ado, I'm introducing Malone Mcquindy.
Hi, thank you for your introduction.
And so Malone, we spoke briefly yesterday. You were from the United Kingdom, actually from Birmingham, England, am I correct?
Yeah.
Born to a Zimbabwean family, and currently in medical school at St. George's University of London.
Yeah.
So what, briefly, what inspired you to make Mind the Gap?
So like Dr. Mayo, I'm also a medical student, and whilst being at medical school, is something that we were never taught on darker skin. We were never taught how to identify anything on darker skin. A lot of the language that we use when we're describing how things present or how patients present, a lot of the time is always almost white-centered language and comes with a very heavy white skin bias. And I would often go around asking tutors, lecturers, professors, other clinicians, okay, we weren't taught this, but can you please teach me how to identify on darker skin? Because I was concerned myself that I wouldn't be able to spot things on Black people, on Asian people, because everything I learned is just white-centered. And to me, this was very concerning because I am also Black. So I was like, if I can't treat something which will show up on my skin or even identify it, it almost appeared very problematic. So in my conversations with people, a lot of the time I couldn't find a uniform answer to describe things. So for instance, if I ask, can you teach me what meningitis presents like on darker skin? A lot of the time, loads of people will give me loads of different answers. And whereas if we said, can you teach me how meningitis presents on white skin? A lot of the time people will be like, oh, the red rash. So to me, it was kind of like, why are we leaving dark skin open to interpretation? But where for white skin, we have almost a set way to identify things. So then from there, I decided that we need to start to address this problem. Like the textbook that Dr. Mayo was on about, I've never seen that textbook in the UK. So I'm not even sure if medical schools in the UK even stock that textbook. After all of the work that has come about from Mind the Gap, I'm now aware of some of those textbooks. But even when I've tried to find them, a lot of the sources are based in the USA. So another issue which kind of came from that is the accessibility to some of the information. It's not there. And you and I and a lot of people in this chat may know, when it comes to Googling symptoms on darker skin, Dr. Google's never your friend. Even if you type in, oh, psoriasis on Black skin, you will still get images with white skin. So loads of these things I was looking around and I couldn't find the answers anywhere. So it almost felt as if this information doesn't exist on the internet, and that a lot of this information was trapped in academic journals, academic research. But it's almost like there was no practical solutions on where do we go next. It's like people do the research and identify the problem, but what are we actually doing to tackle the problem? I could never find that answer. So then Mind the Gap was born kind of through that determination to almost provide active solutions to the problem.
And an active solution is the best thing. And this is the time for people who, especially recognizing disparities and recognizing things that haven't been treated equally for so long, is definitely the time to be active. And like I was mentioning earlier with Dr. Mayo about people who've done this and dedicated whole careers to this and not gotten recognition, but a world seeing, in a country, specifically in America, seeing the pandemics that are affecting Black and brown communities, from the disparities in healthcare, access to tests, police brutality, is definitely a key focus right now for people to work towards equity and inclusivity. Did you expect Mind the Gap to have as significant of an impact as it has?
Not at all. So when I actually made Mind the Gap, it almost came from a notion of changing my university. So my specific university. And then after that, given the response, we were going to approach other universities like, this is what we're doing at our university. Please adopt or please take on board everything that we're doing to change the system slowly. But given my social media posts, I think within the first 24 hours, I had like 10,000 retweets on my post. And from there, it was kind of clear to see that this is not a problem which is confined to my university or confined to the UK, that this is a problem which people all over the world are facing. And I think from Mind the Gap, some of the most shocking things to come about was I had loads of African-based medical students who would contact me and they would be like, oh, we have the same problem here, even though the majority of the population is Black, majority of the population is non-white. And it was so shocking to me because I just almost had assumed that they have the teaching there. Of course, clinically and going around in practice, they see these conditions on a day-to-day basis. However, formally and by the book, they were saying that they don't have any information which is on darker skin. And that's just due to some of the effects of like colonialism, which are still existing to this day. So it was really almost unfortunate to see that stuff like that still exists to this day. But given the almost attention that Mind the Gap has got at the moment, it's so clear that almost everyone who was ignoring this problem for so long, they've almost been given like a slap in the face, and like, now is the time to wake up. Now is the time to address the problem, because it clearly cannot go on for many years. This has been a problem, like Dr. Mayo said, that is not new. Some of the healthcare disparities that exist in the UK have existed for almost 50, 60 years, and it's just the same stats which have been going on all the time. And I'm sure in the US there's similar problems too.
Yes, and what you were mentioning about Africa earlier, and that's something that blows my mind, the fact that in the continent of Africa, medical education is also lacking in inclusivity of darker skin. And you hit the nail on the head. It is kind of that legacy of colonialism. And not only that, looking in the history of the institution, and for so long, a field that has been mostly dominated by white men, and a lot coming from Europe, and kind of that Eurocentric view that has created the social constructs that has limited people in not only their educations but their identities. And the difficulties you've mentioned earlier, and me and you spoke about this yesterday, in finding pictures, and you can't Google it. Finding meningitis, it's been hard. And you recently opened a link for people to submit. And have you been reaching out? And how's that been, finding more images?
So at the moment we opened the link, which on 2 days ago. So on Wednesday, it's actually almost exactly 48 hours since the link opened. So at the moment, we have been getting a few submissions which are subject to like consent forms being filled out, so that the necessary consent and people are the owners of the images. But the aim of that is to almost make a one-stop shop almost, where people can come and see all images on different shades of black, to say that being black, being Asian, it's not a monolith, because even where I was finding pictures sometimes, it would just assume that this is what black is. But even given in the chat amongst us, we are many different shades, and conditions will present differently, like say on a lighter person who is still of black origin, or a darker person who's still of black origin. So it's important that we document the whole spectrum. So that's the platform which we're created and is running at the moment. And as the website grows, you'll be able to see a range of different shades of color and their depiction of diseases.
And earlier, privately, I connected you with many of the people who are in this chat. And thank you so much to all the UAB administrators here. Dr. Peterson, Dr. Young, I saw Dr. Hosley, some people from the URIM house staff. I don't know if Dr. Ben Wagner is here, but thank you everyone who has come out and supported this. And I want to do everything I can to try to connect Malone, Dr. Grabowski, and connect Malone with using, if UAB could help him, and trying to figure out what could be done. Because looking at the demographics of London compared to the demographics of UAB in the heart of the South, where London is a little over 10% people of African origin, and a city like Birmingham, which is close to 70% Black. And Dr. Mayo could probably attest to the differences between her different locations and the everyday patient population she sees. I think you're muted, Dr. Mayo.
Thank you. Sorry about that. We are definitely in a location that is an advantage as far as seeing conditions in skin of color patients. I would say even more so, we're still at an advantage when you look at the entire United States as a whole. You know, this is definitely a population where, as medical students, you may be taking for granted the patients that you're being exposed to and assume that it will be that way, you know, elsewhere where you train. But really, this is the time to see these patients, to see the different things and these types, to pick up on the disparities, to grab those passions that you're going to use to further drive your careers.
Yes, and Malone, you said it was okay yesterday. You gave me a copy of the digital Mind the Gap from Black and Brown Skin Company, if I can show that.
Yeah, that's fine.
Okay, I'm gonna link this in the chat. And this is the really the first edition of Mind the Gap. And I'm gonna copy this in so everyone can see, and it has a downloadable PDF. And looking to see how we could assist. And this link pulls up the Mind the Gap. And we'll just look through it briefly, but seeing the contents, these different pathologies, and so many of them, like you were saying, meningitis, that you weren't able to see. Let me keep up with the chat. But everyone, be sure to take this link, look through, and see it's not only African Americans represented. And for third and fourth years, hopefully this could be something helpful when you come in clinic and you are, especially on your derm rotation, and you're seeing tinea capitis, and you're seeing these different conditions. Because especially like jaundice, thinking about if someone has pale skin, the yellowing is probably a lot more evident than if you have someone darker. And for a lot of people, that could not be considered, especially in a place where the patient population is so much fewer darker skinned individuals. But just wanted to be sure to share that. And so getting into the general discussion, please put your questions in the chat. And also Dr. Mayo, if you could put the name of that textbook you mentioned, if anyone missed that. But I wanted to ask you both about the idea of race-based medicine. That's a term I had heard some, but in recent discussions, the past couple of months, not only with medicine as a whole, UAB's been hosting some town halls and generating conversations about race-based medicine. And is there a place for that? Thoughts on it? Dr. Mayo, if you could comment.
Unmute myself. So I'm not really sure exactly, what the term means, but I can tell you what I perceive, the term to mean when I hear race-based medicine. I hear it meaning acknowledging that there are some things that you need to identify that may be different amongst different populations as it relates to medicine and their medical needs. And so I do feel like that's important because as Malone and you have kind of spoken about, things present very differently. Things that can be very serious can present, very differently. And people need to know that there are things that present in skin of color, African American, Black patients, for instance, discoid lupus, things that are medical conditions that have true systemic associations that can have some bad outcomes. And so acknowledging, one, that there are differences that exist that we need to be aware of. I think that can be very helpful and very useful in medicine. I do think, people are so politically correct that sometimes they just don't really, they may not want to broach the subject of, people will say disparities, but when you're talking about skin, it kind of gets to, well, wait a minute, is it okay to say, we're going to focus on skin of color? It's okay for me to say that, but then, other physicians may feel like, oh, how is this going to be interpreted? So I think if we all acknowledge that, okay, in medicine, there is a lack of diversity in medicine. And so sometimes the education that you're getting on something that may be about skin of color may not come from someone of color, but if they've been educated, then you kind of need to be accepting, of that and kind of let your guard down a little bit so that that person can also let their guard down and share all that information with you. So I feel like this is some, in my opinion, if I'm interpreting, this term correctly, I think that this is something that can be a big advantage. But then also when we talk about disparities, like not just skin and not just the, skin manifestations of systemic disease, but just disparities in general. If we feel open enough to be truthful and just say, Black patients die more frequently from this, then that kind of alerts medical students to just how big of a problem, this condition may be, and they need to be aggressive, when they are addressing this issue with patients. So I look at it as something that is needed and something that is positive, if I'm interpreting it correctly.
Okay. And I can see that too, is like being colorblind would definitely include a level of ignorance, and race is something that should be acknowledged.
Right.
Malone, do you have a comment on it?
So I think for me, one thing that in medicine that we have to do is, for like the very first step, in my opinion, is to acknowledge that medicine is political. And a lot of the time that as medicine or medical students in the UK, we assume that medicine isn't political because it isn't political in the common sense. But in my eyes, wherever you put people, there's always going to be politics. So once we start to challenge that medicine can be political, people will be more accepting of the conversations around race, because a lot of the healthcare disparities that we see and which exist in the UK and even some of them in America, they are problems which have stemmed, even some of them come from the times of slavery and some of the implicit biases and beliefs that people had at the time, and almost some of the scientific experimentation, and I put that in quotation marks because it wasn't always science. Some of it was just people's beliefs, which have been carried on and passed down through the years. So I think it's so important that we start to have these conversations about race-based medicine, and people are aware that, oh, different groups of people will respond differently or react differently or just take on treatments differently. And once we are able to have those conversations, I think it's so imperative that we make that inclusive of everything. Because I think, although right now, I think it's great for us to center the conversations individually, but I think potentially in the future that might increase the almost implicit biases that people have to certain groups of people simply because they're almost seen as different or other. So I think it's so important that the end goal as well is to make it so inclusive of everyone.
Okay. And let's get to some audience questions as well. And what you said about politics, you're right. And I think that with the how polarizing politics is, especially in America, with just the state of the bipartisanship and how the political system is set up, is to where a lot of people don't want to acknowledge it. And not even in the sense of government politics, but politics among people. And whenever people are in a place, you have that politics coming. And I'm sure a lot of the deans and administrators can speak on the politics of working within an organization. And going to some earlier questions to make sure we get through those, Netta had the first question. And she said, this is probably more for Dr. Mayo. How do you combat the perception regarding diabetes presentation and darker skin at the skin folds? She's heard several physicians mislabel them as the patients being unclean. And how can you bring awareness to older beliefs?
So yeah, what you're referring to is acanthosis nigricans, and that can be a presenting sign of diabetes, or it can be associated with other conditions. But yes, you're absolutely right. And again, we have to think, like we had mentioned earlier, not everyone is exposed to skin of color. So even though that velvety texture of the skin in a Caucasian, may be there, it may not necessarily be hyperpigmented or darker than their normal skin. So again, there comes the opportunity, right? So even there's opportunity for physicians to teach medical students, right? But there's also opportunities for us to teach each other. And so now that you all are entering, the healthcare field, some things you are going to also have to teach other people about your race and your ethnicity, and just kind of some of the, I know I'm always informing, and this may be colloquialisms, and it may be because I'm from Alabama, but I feel like I'm always informing residents of, oh, well, in Alabama, often there's a tradition that if you do this to your skin, this will happen. So first, let's address that so that they can then hear and understand that, what you are meaning to tell them they need to do to treat this, So, and sorry, I don't mean to get off base. So I'll leave it at that.
It's good. And that's big. That's big in being able to address that. And this is a question for Malone and Dr. Mayo. Well, Malone, it seems that a lot of people in the chat are asking, can they have your Venmo? People want to contribute to you.
I actually don't have an account.
Okay, well, if you have anything you want to link in the chat, any foundation, any cause you would like people to contribute to, definitely put it there. And we have a question from an MS1 on Dana as in PDS, which is Patient Doctor Society, is an introduction after orientation, kind of transitioning first year medical students into the healthcare system. And Dana asked that they learned about using race as a proxy in medicine and that skewing how patients are treated due to physicians' underlying biases. Do you think that by recognizing the differences between darker and lighter skinned patients, which is important and crucial, will impact a physician's implicit bias in treatment plans? And for example, a special brand of medication for only one skin type or skin color.
So again, I'll kind of highlight, from my clinical experience, there are certain medications. I'll just give you this very quick example. So as dermatologists, we often will prescribe antibiotics for inflammatory conditions because they're also anti-inflammatory. So for a patient who I may want to prescribe a tetracycline for acne, well, I'm not going to choose minocycline because it has an increased risk of drug-induced lupus. Well, African Americans are higher risk to get lupus, so I'm going to choose doxycycline, instead. And then if I need to consider minocycline, down the road, I may. So I mean, it's just those small little nuances that you may add to your treatment regimen, or that you may consider based on your knowledge about understanding differences between how prevalent something is in one race versus another. So I want to make sure I address the question, so I'm going to find it in.
It was at 1241, if you scroll
Okay,
up.
I see it here.
And Dana,
So,
definitely, you can unmute yourself.
Oh, okay. I was just going to say, as far as like implicit bias, I think these types of talks and forums are very important to help people understand that they do have biases, right? And so one talk that I often will give to residents is, again, about, Black hair. And there is this thought about, well, one, is not healthy. It breaks easily, it's dirty, you only wash it once, all these things. And I say those things, and I say, you may feel this way and you don't want to say it. So let me explain to you what you may be misinterpreting as unhealthy, So I feel like if we can identify and acknowledge the things that people may be unconsciously thinking, because that's what they have been either taught somewhere or kind of seen in the media, and they may be holding on to that, and it may be impacting the way that they address patients or treat patients. We hear about this a lot when it comes to pain management and skin of color, that type of thing. Then if people can acknowledge that in themselves, then yeah, that can help, erase that. So, but it does take some interest in that person to want to make a change.
And that's definitely something I feel that the conversations from my perspective, seeing UAB's work, to have these conversations about changing culture. And that's a big question, is identifying a problem is one thing, but changing the culture of a profession, and where people are more open to having these conversations. And hopefully this can be a step towards that. And Malone, I wanted to ask you, as a university, as a medical center, what would you ask of the people here who have the power to influence change? What would you ask of them?
So at the very top, I think it's so important that we start integrating this information into even lectures. It shouldn't be students having to go and do extra reading to find this information out. It should be just all lectures should be inclusive in some sort of way. I also think it's so important that people go and unlearn some of the biases that they have, so that they are open to learning going forward. So I think one important thing to addressing the problem that there is today is we kind of have to step backwards to go forwards first. This can be just educating yourselves as an individual to some of the biases that Dr. Mayo was on about, like such as black hair. One of the biases that exists in England is that black people have a higher pain threshold, or to say that the strong black man or the strong black women stereotype. So when you get to a hospital, you often see that if it's a big black guy, for instance, and is asking for paracetamol, people will almost be cautious to give him the paracetamol. Whereas if it was another patient, they may just give them the paracetamol at hand. So I think it's so important that the people at the top start to unlearn those biases so that it can trickle down throughout the system. Because the reality for myself is when I walked into the door at medical school, there was no biases that I had towards patients or anything. Obviously, people come with their life experiences and what they believe about other people, but how to treat people, in my head, it was we're going to treat people equally. However, when you start learning these things and only finding out about Black people when you're talking about HIV or sickle cell or genital warts or something like that, then those biases start to manifest. Or only hearing about Asian people when you're talking about TB, those biases start to slowly manifest. And then you get to the time where you leave medical school and you have all of these biases, which in my opinion could have been avoided. So alongside Mind the Gap, this is slightly going off topic, but alongside Mind the Gap, we also thought that it's not enough to give people a handbook and say, okay, this is the handbook, go and read it. Some of it, we also need to provide access solutions. So one of them is training within our university. So we have, the way our university is structured is that final years and fourth year medicine students will teach like first year's basic clinical skills. So we hosted a training session with these final years and fourth year medical students to train them how to teach the first years and second years. And we found doing a pre-session survey that 71% of these students could not identify what pallor looked like on Black people and Asian people, which is very concerning when you think at the time of running that event, some of the students who are taking part in that survey were final years. And in the UK right now, they're doctors in training on the hospital. So to think that at the last hurdle, that majority did not know how to detect someone going pale, which is a warning sign to many different things, is very concerning. So I think even at your university, I don't know if you guys have a similar system in place, but I think it's also about training the people in the university to say, this is how certain things present. We need to be wary about some of the language that we use, and different things like that.
Okay. And definitely, like you said, like it has to start at the top. And I know those conversations have been happening all across medicine. I know in the US and probably globally. And at UAB, kind of one of the things that inspired this discussion series was the Medical Student Services undergraduate medical education started having town halls and hearing from students on concerns what they felt like could be improved on. And I know a few people have to go, but if Dr. Peterson, Dr. Van Wagner, Dr. Grabowski, anyone wanted to comment about just that experience.
So thanks, Michael, for the opportunity. And thank you, Dr. Mayo. Thank you, Malone, for the opportunity as well. Learning from you has really been incredible. So I appreciate that. Very quickly, one of the most challenging and also I think one of the most important experiences that I've had since I've been in this position is getting to learn from our students, especially during this time of social justice, has come back to the forefront. It should have never left, but has come back to the forefront. And what we acknowledge and recognize is, based upon those conversations that we have had, is that change does need to happen. And that change that is occurring at this point has to happen, just like you said, Malone, within the curriculum. It needs to become an integral part, an integrated part of the curriculum, so that there is no separation. This is how we take care of people and all people. And so I know that I know that change takes time, but one of the steps that has been, I think, a fundamental piece to this is that, and Dr. Hosley, I don't think is here, he had to go to clinic to speak for this, but he has worked incredibly hard to find an individual who can help us with just that, improving the curriculum and integrating exactly what you've been talking to into the curriculum. Transparency is another piece. transparency in how the school works, and how we are supporting all students is another important piece of this. I don't want to take up too much time, so I'm going to stop there because I know we're getting close to the hour, but just to reiterate what has been said, that's what we're working toward. It's taking time. We acknowledge that. But what I can promise you is the momentum is there. And this isn't just something that is going to die off and go away. This is something that needs to happen and will happen. And we've started the process. So thanks, Michael, for the opportunity to speak.
Yes, sir. And Malone, that's Dr. Nick Van Wagner, UAB's Dean of Medical Student Services, and as well as Dr. Todd Peterson, also Dean of Medical Student Services here.
Hi, Michael. I have a question. If you have time for one question.
Yes, sir.
Yeah, this is Mohammed Rija from URM House staff. I'm a resident. You have a question, like, I think it's especially to you medical students. A lot of times there's a perception that, if you're a minority, then you just kind of focus on doing, primary care because of the gap there. But then it's kind of ignored a lot of time that also we need also minorities in the fields like dermatology, like Dr. Mayo was explaining, and also other subspecialties. So is that your experience that, like, as a minority student, you're pushed in that direction, or at least, or not encouraged to do the subspecialties, where there also you have different diversity needed for the medicine to really work? So that's my question.
Sorry, was that question at me?
For both of you, like in UK, but also to Michael and medical students here at Birmingham.
Okay, so I'll answer from a UK perspective. So I know the progression pathways once you complete medical school are almost completely different in the US and the UK. However, I would say one thing that my personal belief is that although there is almost like a minority of familiar faces in some of the fields, such as dermatology, even in the UK, I think for me personally, I don't let that almost get me down, because I think one thing that we need to do is increase representation. And I think it'll be so difficult to increase representation if I personally am not putting myself in spaces to almost increase representation. So even another thing from a medical student point of view, in the UK, there's not many black males that go to medical school. So even on my course, I'm one of 3 black males on a cohort of about 300 people. So we make up about less than 1%, I think. So I think sometimes it's so important for representation just to be there in places. Of course, this is not something that everybody's able to do. And I understand that some people may feel pressured or pushed into other specialties simply because it's harder for them to progress there. But from my own personal perspective, it's something that I would love to pursue, to almost get the foot in the door and open the door to many other people behind me.
To respond, I felt that pressure to go to more primary care fields and less specialized at times. Not as much from medicine, but from my community, my family, Black people around me, and the need, and a lot of people wanting to see Black faces when they go to their family physician. I know for me, when I was a child, it was a big thing for my mother for me to have a Black pediatrician and me seeing him. And that's something I thought about with looking long-term as far as a career, the impact. Because growing up in Birmingham, going to school at UAB, and I've never felt as self-conscious about my race in the sense of my identity until medical school, because I never felt like such a minority. And that's been a shift. And it's almost like a call to be the representation, to speak out, and to make sure that my voice is heard. And I never felt like that. And that's something I'm still understanding, and especially following the Black Lives Matter movement resurgence in the past couple of months, and the conflict of to be an advocate, how much to be an advocate. And even in medicine, like Dr. Mayo and her work with Black skin, feeling and navigating that pressure of, if I am not working to serve the Black community, am I not being true to myself? And a lot of my interests have shifted to focus specifically on underrepresented groups, Black America, and more on the groups that aren't represented, and making sure that they have access, and seeing through quarantine things that just aren't addressed in certain minority communities, like mental health, and how that could be exacerbated with a quarantine, with riots in a downtown area. And like Dr. Mayo was saying, so many people, because they don't see Black faces, they don't feel comfortable taking off their wig and showing their scalp and showing how bad their skin truly is because of the fear of being judged. And that is something where being in primary care, you would have probably the most opportunities to have that type of impact with people. So I'm not sure. That's something I'm still navigating. And Dr. Mayo, if you could comment on that briefly, and I'm going to get to Candace's question too.
Yeah, I can tell you, I felt very discouraged. Well, first of all, I was a fourth year, but I can tell you, when I was navigating all the different fields, I felt like I was put into a box because I was discouraged. I felt like all of my other classmates had all of this preparation and knew all these things about medicine. So I'm a first generation college graduate. So I just kind of have been navigating my way, you know, and here I am, I'm in this medical school. There's very few people that look like me. There's very few doctors that look like me. I'm definitely not going to say I want to be in a specialty, at least this is how I felt at the time, that is considered, you know, a difficult or challenging specialty to get into, because I'm just happy I'm here, you know, so that is, honestly, that is how I felt at the time. And then I remembered when people started declaring what specialties they were interested in, it was, well, this is all based on your scores, you know, and I felt like, man, well, you know, I don't necessarily consider myself the best test taker. So I felt like there were all these things in place to put me in a box, you know, and it really had nothing to do with my true passion or what I was truly interested in. Well, that and my grandma, when I told her I was going to be a doctor, a dermatologist, she said, I thought you were going to be a real doctor, you know. So yeah, I hear what Michael is saying too. But the truth is, I was afraid to even aspire to something else, because I already had these feelings of, oh no, somebody's going to find out that I'm really not as smart, you know, as I'm perceived to be, that I don't belong, or, you know, that type of feeling, which I think a lot of minorities entering this field of medicine may not feel that inclusivity. They may feel very isolated, that their other medical students there with them don't understand what they've been through to get here, the challenges they've been through to get to the point that they're at, and their mind frame of, you know, I may not be able to succeed because I haven't seen a lot of people that look like me do this before. So I do feel like there is a lot of pressure, I mean, almost in a physical sense, to say, go over here and do the thing that may be the easiest path for you to get this MD. Because that's, you know, primary care, that's still an excellent field. You get to reach, you know, a lot of people in the community, but you definitely aren't encouraged to consider fields that lack in the area of diversity and help to understand the impact that you would have. It just so happened that I got that one little ounce of encouragement that inspired me to say, you know what, I can do this. I can make a difference. I don't care what my board scores are. You know, I can figure this out. So yes, sorry, I was a little long-winded there, but yeah, there are some real things that I think, you know, we need to try to address with including minority students and making them feel included in these fields that are considered challenging, difficult to get into.
And I'm interested in seeing the shift that may happen in minorities being able to break into more specialized fields with what is viewed by many as an obstacle, such as step one, shifting from a score to pass fail. And to a lot of people, like you were saying, feeling that pressure of, because of my step score, on top of me being a minority, it's going to be so much harder. And I'm interested in seeing 5-10 years down the line if people have more confidence in that. And so Candace had a question earlier about, and this is to both of you, whoever wants to comment, how pertinent is it for all medical students to be knowledgeable of skin findings in all areas of medicine? For example, suggest hypoxia. You just look at the patient as blue, or things like erythematous rash, I can never say that right, when looking for anaphylaxis.
I'm a dermatologist, so of course I'm going to say I think it's very important. But again, I can't stress enough that dermatology isn't just outpatient, care. It's not just acne and cosmetics, which I feel like that's kind of the perception of dermatology until people come and they rotate with us. Dermatology and skin findings truly span all specialties. And you can really learn a lot about what's happening internally based on what's happening externally. The other thing is patients can't see their blood sugar, but they sure can see that rash under their arms or on the back of their neck, like we were discussing earlier, and that's going to bother them and bring them in. So then you have to know, oh, wait a minute, this rash may indicate something else that I really need to be searching for. So I do think it's important.
Malone, not to get too clinical, but from what you've seen and what you've seen in making Mind the Gap, do you have any thoughts?
So I think it's so important that all, wait, let me scroll back up to the question.
It was around, I think, 12:30.
Okay, I found it.
Okay.
So yeah, I think it's so important that all medical students are knowledgeable of all the skin findings, because I think this is something that as we go through medical school, we're going to have exposure to in one respect or another. And I think it's like what Dr. Mayo was saying, that what is shown externally can be indicators and warning signs for what's going on internally. And if you're not able to identify what's going on externally, these warning signs, potentially you're always compromising the care of people because you cannot see what's going on the inside. So for like the example she gave of the patient going blue, that was also another question on the training that we did. And many people who are medical students, third to fifth year, which is final year in the UK, they couldn't identify the sign. So of course, that is a warning sign for other things which are underlying and going on the inside. And I'm not sure if that entirely fits with the dermatology umbrella, but it's still something which is so important, which could be the difference between someone living or someone having to have an amputation or something serious having to be intervened. So I think everyone should be getting clued up on what signs and symptoms look like on darker skin.
Mm-hmm.
Okay, we want to go a little bit longer and wrap up soon. I'm looking through, I saw Victoria Odom put a question. I'm looking to see, okay, we spoke about the significance of integrating the topics into lectures.
I think also to add, I'm not entirely sure if this is how things function at your university, but from speaking to other universities based in the US, it almost appears as though each university almost has their own curriculum, or they control their own curriculum to a certain extent. So I think on a global scale, the drive for this work, I think the USA is a very good starting point, because some of the universities in the USA can almost be pioneers to changing this curriculum and almost acting as a model to medical schools even in Europe, because in the UK, medical schools control their curriculum. However, there is a higher governing body which sets, oh, you're meant to do this, 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 and this. So medical schools don't have full 100% control, but from my conversations with other people based in the US, they were telling me that each medical school has 100% control. I'm not sure if that's entirely facts, but I think if it is facts, I think the USA you guys are in a brilliant position, like the heads and the deans of the medical school. You're almost in a brilliant position to act as almost the pioneers for this change globally.
Okay, and with that, I'll ask Dr. Peterson. I'm not sure if anyone from UME undergraduate medical education is here, but if you or know much about it, because I think from what I understand, the curriculum is taught a lot around the STEP guidelines.
Yes, you know, obviously we want everyone who graduates from UAB to be able to pass their boards and become a successful physician. So there are certain broad metrics that have to be met, but within that there is some freedom. I think one thing that is very positive that's happened, you know, within the past year is that step one is going to pass fail. I do think that's going to lower some barriers that some students have had to enter some specialties, but more importantly, from a curricular standpoint, as an institution, we're going to be a little less beholden to make sure that we focus only on the content that's going to be on that test. Because previously that was such an important barrier professionally for so many students to enter the specialty of their choosing. You know, with that being a little bit less of a focus, you know, we're going to have more time and space to tackle the things that are truly important. As a graduate of UAB, as an ER physician, I can tell you the first couple years of my career, I felt very ill-prepared to recognize cutaneous manifestations of systemic illness in my patients of color. And then over time, you know, you certainly notice patterns, but that's something that I truly had to learn, you know, on my own as I progressed in my training. And I can't tell you how enormously grateful I am for everyone's work in trying to tackle a significant problem. And I certainly want UAB to be a leader in this and other forms of education that are going to really tackle some of the important issues for all of our students and our patients.
I'll just add that I know for this upcoming year in the musculoskeletal curriculum, I'll be giving a specific lecture on skin of color. And I know that other lecturers have been asked to integrate more images and more descriptions of skin of color within their lectures.
And that's the change. And like Dr. Ben Wagner was saying before I had to go, it takes time. And that's kind of each year in being more inclusive and bringing in more faculty, especially diverse faculty, being able to see that it's going to be great. And Victoria, as
Can I ask you,
oh yes,
out of curiosity to Dr. Mayo, do you think the almost attention and publicity around Mind the Gap influenced the need to put those lectures in for this? I don't know if your academic year started, but for this coming or current academic year.
So yes, so actually I've given this lecture before. So I am a lecturer for medical student education, and honestly, one of the reasons that I was so adamant about being a part of medical student education is because it gave me the opportunity to include more photos. And a few of my lectures have been on acne and then systemic manifestation of cutaneous disease. And I changed a bunch of the images to be more representative. But then this year, so I'd given a skin of color lecture to the Office of Diversity, had asked me to do it. But as you had mentioned before, it was like something extra, not something that's integrated. It was optional. So only people who had an interest in that, you know, would come to something like that. Whereas this year, actually, there's medical students kind of drove the initiative in I think one of the town hall meetings to say, hey, we want more images. And then some students actually reached out to me saying, we saw this many images in dermatology and only this percentage were in skin of color. And I took that back to faculty, and the committee kind of came back with the medical student education curriculum, and we said, well, what can we do? And I was like, hey, I got this lecture, you know, on skin of color. That may be a way that we can go forward. And everybody was very supportive. But again, it was the movement. I don't know. I think it was a little bit before I had learned about Mind the Gap, but I'm not very good with social media and staying up on social media. So I'm not sure of the time frame, but it may have been been the social justice movement, it may have been the racial justice, movement, or it may have been some of the interest that has spawned off of Mind the Gap. I'm happy whatever it was.
It's definitely interesting seeing kind of how social media can just propel something into a national spotlight. Because I remember I had seen Mind the Gap initially on Instagram on very niche areas. I think I saw it in the Shade Room. And like Atlanta Black Star. It was like very niche, very Black news outlets. And then one day I look and Now This is saw. I was like, wow, it picked up. And then I think it was the next day, the Washington Post. And I saw you on like a news outlet speaking. I was like, wow. And at the time, I already reached out to you. I was afraid you were going to ask to get paid for this. But Victoria Odom, and we may wrap up after this, as how do the speakers feel about how to reach ears in medicine that need to hear these discussions but are reluctant?
So if I answer first, I think, like I said earlier, it's so important that we can almost address and highlight why this is such an issue, so that people can almost unlearn some of the biases they have before learning what is needed going forward. Because I feel like if we don't allow people to unlearn some of these things, their biases will just get deeper and deeper. I think one thing that is happening at the moment is that almost the voice and the cry for all of this information is so loud that even if people are reluctant, I feel like it's going to show up somewhere soon that you didn't listen when everyone was telling you that this is what needs to be done. So I think although people may be reluctant, I definitely think they're very aware. So when the time changes and I can feel a change which is coming, because like I was just asking, since my post about Mind the Gap, I now even see most stray random posts about COVID, and now they're including pictures of, oh, this is what this symptom looks like on white skin, this is what it looks like on brown skin, this is what it looks like on black skin. So I feel like sometimes it may feel like people are not listening, but one thing for sure is I think the cry and the almost agenda around the work at the moment is so loud that people have no choice but to almost be aware of what's going on.
I totally agree with that. I'm happy, at least for UAB, I can say I think leadership has done a good job in attending discussions like this and listening, so there's a time to not talk and listen. And I think, you hear what medical students are saying they want, what they need, where the gaps are. And then that gives a great opportunity to actually make that change. And so I do think this is a time where we want leadership to listen to what we have to say, listen to our feelings, listen to our experiences, so that those changes can be built around that.
Thank you. I appreciate it.
All right, and one last question out of genuine curiosity. Malone, has this made you interested in dermatology?
I get asked this question all the time. I think for me, I haven't yet chosen a specialty because I'm still keeping my doors open to all different types of specialty. And in the UK at the moment, there's almost a rise of like subspecialties which don't have formal names for, but people have kind of made their own niches. So there's loads of different things that I'm still yet to see. I'm starting my clinical years. So the way we do our courses, we do 2 years preclinical, which is just lecture-based, in university-based, and then 3 years clinical, which is all on the hospitals, different wards, seeing patients. So in the next 3 years, I'll be able to give you a clear answer on that question.
Well, this would be something great for an application going to any specialty. And thank you all. Thank you all for being here today. We're working on getting a home for the recordings. I'm looking into different places because we have these recordings and we want to be able to keep up with the impact lasting. So I'm reaching out to a lot of different places and trying to find a definitive platform for us to be on. But thank you all for coming. Malone, thank you. And Dr. Mayo, thank you. And Dr. Peterson, all the administrations, all the students who came. And we want to keep this going. So the links I posted earlier, if anyone has any ideas on what we want to speak on, let us know. I put up my email and everything in the chat. And also one thing I've just kind of been bouncing around is going into professionalism, and recently the med bikini thing. And I want to hear from women in medical school about their thoughts, their feelings, and might try to get something going on that. So reach out to me if you would be interested in that, especially student leaders within the School of Medicine and any female residents or attendings and going into that. But thank you. Thank you all so much.
Thank you. Bye.
Thank you.
Thank you both for taking the time to come to this.
No worries.